The Honourable Annette King.
Mr Speaker, I have to say to my cousin opposite that Labor doesn't hate success. What we do hate is excess and greed. And that is what we have seen in this budget, but not just this budget. Every budget that has been laid down by this government, we have seen excess and greed for a small group of New Zealanders, not for the majority of New Zealanders, the hard-working people who go to work every day to support their families. But we saw it when they gave tax cuts to a very small number of New Zealanders, the top wealthiest New Zealanders who got the tax cuts, even though there was a global financial crisis and we didn't have enough money to feed the children. But we had enough money to give tax cuts. We've seen deals done around films. We've seen deals done around convention centres. We've seen appointments made that are not transparent, and there is a certain level of cronyism. That is what we dislike, Mr Speaker, and that is why we will speak out against it. You know, I saw this budget very much as a political point-scoring and posturing one, because there was a lot of feel-good factors, and I think John Armstrong got that right today when he talked about the response to the expert committee on child poverty. He said there were feel-good factors in it, but in fact what you really got out of it was a disgrace. Just enough money to get a headline, but not enough money to make a difference. And I say you can fool the people some of the time, but not for long. And so when the sugar hit from the flurry of press releases and the TV coverage and the extended interviews were all over, eventually it turns to the headache when you start to unpick what the budget actually means. And I don't think you could get a better example than the response to the expert committee on child poverty. You see, on the day that the government responded to that expert committee report with its 78 recommendations is the day that they put out their response to food in schools. Why? It was deliberate. It was to bury their response to the expert Working Party report on child poverty. Work that had gone in for months and months, very good and detailed recommendations, but they put it out when they did a little bit of money that doesn't quite go far enough or make a difference, but does manage to cover up their pathetic response to the expert committee. Well, I have to say, a lack of acknowledgement and concern and policy development to address disparities in New Zealand does not exist just in social development. It is a major problem in the provision of health services in New Zealand, Mr Speaker. I found it staggering at a meeting I was at last week with health professionals when they told me that the Minister of Health, Tony Ryle, had told them that if they raised the question of disparity again, that he would not meet with them. They had to stop talking about disparities. Now, that was told to me by highly competent and trustworthy health professionals. He would not meet with them. Oh, privacy matters. Privacy matters, of course. Can't release names. We'll never be able to give names, Tohenare. I'm following the Minister of Justice. It's a privacy issue. But what I can tell you is I trust them, and I trust them that Tony Ryle said if they didn't stop speaking about disparities in health, he would not meet with them. You know, the government was warned about health disparities. Now, this will be of interest to Mr Henare, because the Auditor-General of Health just very, very recently warned that we needed to address the disparities in health for Maori, for Pacific Islanders and for Asian New Zealanders. And the Auditor-General said this, and I'll quote, the Audit Office reported that we consider it vital that these disparities be addressed with the goal of eventually eliminating them. Now, that is a very, very recent comment from the Auditor-General. I'll repeat it. We consider it vital these disparities be addressed with the goal of eventually eliminating them. Well, the only thing that has been eliminated is any mention of disparities in the health sector. Tony Ryle removed all mention of disparities out of documents, even though there is a statutory requirement to report on disparities in New Zealand. And the Auditor-General, in this very same, very recent report, pointed out there is a lack of any targets to reduce disparities in health. So here we have a minister who likes to set targets. He loves targets that you can tick. Tick, I've done this. Tick, I've done so many of those. Tick, I've reduced this time on that. But he will not set a target to reduce the disparities for New Zealanders, the poorest and the sickest New Zealanders, because he doesn't believe there are disparities. Well, I think that that is a very poor approach to improving the health of New Zealanders. You see, this budget, Mr. Speaker, was all about getting a headline, all about posturing and posing, because the minister announced there was $1.6 billion extra in health over 4 years. What he didn't say was the $352 million a year going to health is $200 million short just to stand still. $200 million short just to stand still in vote health. DHB's got $70 million less than last budget. $70 million less. That doesn't take account of the need, of the growth, of the cost of providing health care. He then claimed $191 million that was coming from reprioritisation and savings. Well, it's very interesting when you read the budget documents. We haven't got the savings yet. We haven't got the reprioritisation yet, but he's banked the money and he added it on to give himself the $1.6 billion that will be spent in health. So I asked the question, where is this reprioritisation coming from? Where are the savings to be made? And I got his one-line answer back. No answer at all. He won't say where the savings will come from. He won't say what areas, what DHB, how much, what will be cut, what won't be carried out. No answer at all. Just bank the money and say you're going to get it, but there is no plan as to how it is going to be achieved. You know, the Auditor-General warned this House 3 years ago in the budget 2010-11 that we face serious challenges and expectations that there will be financial pressure on the health services and that it would worsen. 3 years ago, that was told to this House by the Auditor-General, that the government said that they intended to keep restraining funding of expenditure over the next 3 years or more. And much, the Auditor-General said, of the increase that they received would merely keep pace with demographics and cost changes. Well, that was 3 years ago. And I have to say, Mr. Speaker, the situation has now reached code red in many DHBs. So something's going to give. There are going to be cuts in services, more user pays, services pushed into the community, with the community having to pay for them, or there's going to be growing deficits. So I say to the members opposite, look under health service funding, and there you have tucked away $90 million to pay for the rising deficits. That's what it is for. And so when the minister tells you, members opposite, when he tells you everything's going fine in health, you will see in your DHBs around New Zealand this year a blowout in their funding and deficits growing, and he's put $90 million aside to help pay for it. I don't know whether it'll be enough, but it is under huge pressure. Right now, district health boards are writing their district annual plans. They have to provide him with a break-even budget. But they have told me they don't know how they're going to achieve it. All they can do is write and say they're going to do it, but they have no idea how they are going to be able to achieve it. And one last thing, Mr. Speaker. The Minister makes wonderful announcements about what he is doing for women and children and maternal health, which I applaud. He makes announcements of what he's going to do for children under 5. But then you find the very place that he cut funding in this budget was in maternity care. He cut $12 million out of maternity care over 4 years by reducing the amount that is paid to the lead maternity carer. He has cut $3 million out after each year for 4 years out of the lead maternity carer. Who is going to provide the maternity care for our babies? So he gives with one hand, he takes with the other. I find this minister to not be straightforward in terms of what's happening in health, and it's my job to ensure that people really know what is going on.
The Honourable Clohanare.
Speaker, I want to start by saying, giving a message to my relation Shane Jones.